Good morning, everyone. Bill Peterson, Executive Director for the Iowa State Association of Counties here, talking to you again on a Friday. I want to wish you a good morning and a happy May Day today. I want to thank all of you for joining us on this call this morning. We hope you're well and taking steps to be safe during this time of public health crisis and economic disruption. Today, we're pleased to have Kelly Garcia, Director of the Iowa Department of Human Service, join us to share information about what DHS is doing during this health crisis. So at the conclusion of Director Garcia's participation, so she'll be on till about 10:28, and then she has another appointment. So we'll get a brief update from Jamie Cashman as well. So before we get started with Director Garcia, I want to just make a couple announcements. First of all, we'll have a recording of this call available on our website later today. As mentioned previously, you can also find recordings of the previous 3 calls on our website. And in addition to those recordings, there are many other pieces of information on our COVID-19 section on our website, which is at www.iowacounties.org. We have a number of questions that we've already received, but if you have any questions that you want to submit during the call, please submit them to rbennett@iowacounties.org. And finally, if you want to receive updates on a timely basis, you can send in a request to support@iowacounties.org to be added to the Basecamp site, which we update consistently throughout the day with any new information that we believe would be helpful to you. With that, I think let's get started. So Director Garcia, I want to thank you for joining us today. I hope you're well.
Thank you. I was taking myself off mute.
Okay.
I really appreciate the time today. You know, I think as we talked about on the last call, I just really feel like we can't have enough communication at the moment, making sure that we are highly coordinated during this time and remain highly coordinated as we move forward, because I think I heard the governor say this yesterday. We certainly have been talking about it internally in our agency for quite some time. You know, in some respects, life will go back to a new normal here in the next several weeks, but we need to be prepared that it looks different, and it will for a really long amount of time. And so we are in this for the long haul. We are thinking about what our practices and procedures now look like, how we can shift and become more nimble. And all of that means that communication with our community partners is paramount. I mean, it is on a normal day. It especially is right now because things can change on a dime. There were a couple of areas that I wanted to just provide a brief highlight on that I think will be of most interest to y'all. And then I really did want to spend the most of the time just allowing y'all to ask me questions since we only have 30 minutes. So first, given the governor's order that goes into effect today, that does start to open up some businesses and provide some relief to the economic impact that this emergency has had. We've received a couple of questions about what that means for our own business practices. And I've, of course, been in coordination with the governor and her staff. We at this time are not changing any of our business practices. Our offices will remain by appointment only for the next couple of weeks, and we will reevaluate around May 15th about what that looks like moving forward. We're going to put some information up on our website today. And like I said, you know, if for some reason there becomes a need for us to shift that in the course of the next 2 weeks, we will. We're happy to entertain those conversations. But for right now, we are going to kind of stay the course for a couple of weeks. And that includes our shift to have electronic first visits for our foster children and their biological parents. Those visits have been determined on a case-by-case basis throughout this event. We just shifted it to more of an electronic mode, unless otherwise necessary in the past couple of weeks. And we're going to keep that in place while we kind of weather the storm of being in the peak and then kind of go from there. Obviously, that is really important for us to move back to the way normal business is as soon as we feel that we can secure enough PPE to make that happen safely. Second, we have a significant amount of funding that has come through our agency, including an enhanced federal match on the Medicaid side of our program, and some additional dollars through the CARES Act legislation that is designated specifically for child care providers. And for both of those distributions of funds, we are incredibly close to being able to release that publicly. Our teams have been working with community providers. We've had a few forums where we've taken input on exactly what the need looks like. And so that distribution has been highly coordinated with the other agencies that have mainly economic development and Debbie Durham's group. We've been coordinating with them. We have a couple more steps we need to do internally, but we are very, very close to being able to release those funds. And we know that that's incredibly important. We know that exactly, how much of an impact this has had across the system. And so we will be really excited to release those dollars and see what kind of results we get with applications coming in the door first and foremost. On the Medicaid side of things, we have some funding formulas, and so there'll be direct payments made through our fee-for-service program, even though that some of the individuals and entities are provider groups are in managed care under normal circumstances. So more detail to come there, but all to say that we have some economic relief headed out to locals very, very soon. So all good news. There continue to be some direct payments made by the federal government through the Department of Health and Human Services direct to providers. And that is something we've also been coordinating with the governor's office on. Sometimes we have knowledge of what the payment amounts are because the providers alert us, and sometimes we don't. And that's been something that's been a bit challenging for us to see exactly how many dollars are going and where in the state. So we just continue to work with our federal partners on having some sunlight shine on that process and ensure that we aren't missing any key provider groups in the distribution of those dollars. So that continues to be an ongoing conversation. And then lastly, respective to PPE purchasing and distribution of other key products during this time that are mitigation strategies for our community partners. We engage in a lot of dialogue with community partners on a weekly basis and really have tried to make an effort to alleviate some of the stressors that are happening on your local public health departments, as well as your local emergency managers. We've distributed a significant amount of PPE to home and community-based services providers that serve individuals with intellectual disabilities and group foster care providers. So just if you have any need that is going unmet and we can assist in any way, just let us know. We're trying to be good partners where we can be. We're having struggles in our own in a couple of key ordering places, but where we can alleviate some of that need, we are doing our best to help where we can. And those were the three areas I wanted to cover today, just as a brief update. And so now I think we got about 20 minutes left for questions, if that is okay with y'all.
Okay, great, thank you. So I guess my first question is, when you decided to leave Texas to come to Iowa, did you ever expect to encounter all the challenges you faced since taking over the lead role at the Department of Human Services?
So that's funny. That's a funny first question. No. I mean, how could I have possibly understood that this is what it was going to look like? And it's funny because today is my 6-month marker. And it is absolutely unbelievable to think of all of the things that we've faced in the last 6 months in our system. One of the things, and next week, and I can give a thank you to each of you on the call, next week, or actually starting on Sunday, is Public Service Recognition Week. And that's a week that I have a master's in public service and administration. I went to the Bush School of Government and Public Service, and public service means a whole lot to me and has in my career. And what I'm seeing out of this in Team DHS is that I came into a system with a lot of challenges already. There's certainly been more presented while I've been here, and I'm seeing a team that is absolutely willing, ready, and able to rise to the occasion and make significant shifts in their business practices to mitigate some of the challenges that we've had. And so it has been really daunting, but we are on a really solid path, and there's excellent work going on right now. We're going to maintain the momentum while we weather this storm, and I think you're going to see some really big changes out of us over the course of the next year. It won't be as many as I originally planned, but we're not going to lose sight of those big goals.
Okay, thank you. So you had mentioned that there's a significant amount of funding. So is some of that funding making its way to county operations, or is that going to providers, say mental health services? Can you expand on that, or when will we actually see some sort of report on when what's actually happening? I think you mentioned that you're close to getting those funding released, but when do you expect to see that?
We are. So right now, the changes in our program and the additional dollars direct to providers. And that's really because of the shift in the business model that's happened within the Medicaid program. And then what we're evaluating is either lost revenue or additional costs specific to COVID-19, and trying to fill those holes first and foremost. I think, and I may have mentioned this, I know I've mentioned it in other provider calls. I'm sorry. Yes, sweetheart. Sorry, my husband's at a doctor's appointment this morning, so here you go. COVID-19, co-parenting at home with small children. That was my 4-year-old son. So we do have a list of all of the dollars that are coming through DHS, and exactly how what that looks like, and that's a chart that I expect to be able to share externally, hopefully early today, if not early next week, or hopefully later today rather, if not early next week. And there are direct payments that are happening, like I mentioned, from the feds to locals directly, and some of that we can see and some of it we can't. Those payments have predominantly been they have been directed to providers. They have also, including hospitals, so that does affect local level. They've predominantly been, though, around individuals, provider groups that serve Medicare patients, not Medicaid patients, if that's helpful.
Okay.
And then there's the broader dollars, the $1.25 billion, that we are working very closely with the governor's office to assess need. And behavioral health services is, of course, on our list. Yesterday, we received our grant dollars from our declaration from FEMA on individual assistance related to crisis counseling. And so those dollars will start to flow, and all of that really will impact and help alleviate some of the burden that the locals are feeling right now in terms of meeting the needs, immediate needs, and then the longer term needs of what we'll see on the behavioral health side of things, if that helps as well.
Okay, thanks. So I can't remember what day this week it was, but during the governor's press conference, I think she was asked a question about the Invest in Iowa Act, and she seemed to indicate that plans for that were probably going to have to be put aside this year, just based upon the circumstances in the economy. So I was wondering if you had any thoughts about what type of sustainable funding that regions and counties would be receiving if that plan obviously doesn't go forward.
Right. So that's actually something that we're working on internally next week at DHS. And there are some. It's still so early on in this event for us to really clearly see the need and the dollars. And so we've tried to kind of strike a balance, but we also are ready to get ourselves prepared for those conversations. To your exact point, we need to be able to shift given the economic impact that we all know is there, and really start to have some external conversations with the regions about what they're seeing, and how we can all prepare for session to return, and some difficult decisions to be made, I think, by members about exactly how to appropriate the dollars that remain. And so we're not quite there yet. I don't have any inside information other than to say that we acknowledge we still have to make progress on children's services and rolling out that service array for a very vulnerable population. We acknowledge there's a big conversation to be had about how to fund it. And we are ready to kind of shift, reevaluate, and open that dialogue up with our internal preparations starting next week, and then using the remainder of the month to get ready for when members come back. So kind of more to come, I guess, but absolutely an acknowledgement that we have a different conversation to be had.
So is part of that conversation, I'm wondering if there is some consideration to moving back those deadlines for the complex needs in children's system that are scheduled to take place in July. Given the circumstances, I know that this has been a concern of our members, and we've gotten lots of questions about this.
Right, and that's a key component of things. I don't want to lose. We can't afford to lose progress, but at the same time, there's absolutely an acknowledgement that the provider base has been fundamentally changed in a way that augments, I think, what the obtainability of being able to launch those services are. And I would be completely naive to not acknowledge that out loud. And so that's the space that I really need to get with my team. And then we need to have individualized conversations with the regions to make sure we understand, because there's also not a one-size-fits-all approach to this. Although there will have to be, some level of consistency, certainly, in our approach. But I think we need to have really tailored conversations about local need.
So I'm anticipating then that you'll be reaching out to those CEOs, and they could expect to hear from you in the next couple of weeks about this discussion.
That's exactly right. Yes. We also, just internal to DHS, we have been transitioning Marissa Ianson, who is the new division administrator for the community services side of both our mental health and IDD services section of the agency. Trying to do that in the middle of a pandemic when she's the policy director for Medicaid has been quite challenging. And so we are ready to make that transition, have interviews set. And so it's been, kind of an internal shift and dialogue as well that has been, while we've been, very much up to our eyeballs in crisis response too. So we are at the point to be having those conversations now.
Okay, so speaking of Medicaid and Medicaid rates, so one of my members has been trying to understand who exactly sets those Medicaid rates for vendors. Is that done by the IME, or who makes the determination on what rates providers get paid for services?
So if that provider is a service provider in managed care, those are contractual negotiations between the provider and the managed care organization. Typically, the managed care organization follows our Medicaid fee schedule, and Medicaid fee schedules can go up and down, and that is in Iowa. That process happens at legislative direction.
Okay, so the legislature sets those rates, or?
The legislature appropriates additional dollars and or directs the agency to do a review. The agency itself, and my position, like in some other states, for example, in Texas, the Commissioner of Health and Human Services has the rate setting ability. In my position, I do not.
Okay.
And that's something we've had a lot of dialogue about in the Children's Policy Board discussions. That, my own assessment is that a more mature Medicaid program would allow for some regular rate review, but in order to build that out and really do it in an appropriate way that would provide the legislature with clear information about, what the landscape is, respective to private insurance and respective to need and what the service array, where there might be gaps in services in different parts of the state. All of that analysis is what goes into a rate review. And we at IME have 47 staff. So we are not staffed to do that kind of intensive rate review. In Texas, we had a team of several hundred individuals who did nothing but that as a full-time job.
Okay, well, so I think this individual's point was that some of those rates don't make a lot of sense in the grand scheme of things, and he's been trying to figure out how to get that point across, but it sounds like you're aware of the challenge there, so maybe that'll be something that you can put on your agenda for the next year or two or so.
It is on my agenda. So one of the things that I'm going to be embarking on is a review of the structural organization of our Medicaid program and trying to fix and dedicate some staff for exactly that kind of work. I don't think we'll be able to have quite the model that I was used to in Texas, but really having a dedicated focus so that we can tackle some of these issues. We know they're really important, and we can do them in an ad hoc way. But I think, the last time there was a more comprehensive review, it's been a while. And I think, what I really see in this state is a yearning both by providers and certainly members who are tasked with making those very difficult appropriative decisions, with needing to have really clear knowledge about wading into that territory. And we can help with that. We just need to have the right skill sets and a dedicated team.
Well, I had this discussion with Senator Grassley about this. It seems like it was a long time ago, but I think it was just in early March when we were in Washington, D.C. for a conference. And he said the last time the legislature really did their job on that was in the 1970s when he was in the legislature in Iowa instead of being a U.S. Senator. So maybe we can get that done. So let me ask this question. One of the issues that we have heard a lot from our members about, and this was really something that came in the passage of the Children's Mental Health Bill last year, was the additional members on the regional governance boards. And I will tell you, there's a lot of concern by the county supervisors that serve on those boards about having public members voting on issues related to financial responsibility. And so I'm wondering if you're aware of that discussion and have any thoughts on that.
I am, and I think we would probably need to take those conversations out offline and make sure. I am, and we recently had some dialogue with some particular folks who reached out to us. What I will tell you is we have absolutely looked at the statutory construct and what we feel our obligation is. We've worked closely with our AG on that interpretation, and I know there are different opinions, and I very much hear the concerns. I think we'd want to follow up and make sure that we're, I think, more deeply understanding the issues there, and then can have that conversation. We'd be happy to set that up to have a more detailed conversation and really dive into that issue.
Yeah, I guess so. I had a copy of a memo that was sent out by Teresa Armstrong. And we just wanted to, I guess we would like to make sure that we understand what the memo says, because it does leave a little gray area, and I know our members are trying to get those 2080 agreements figured out here soon.
So let me, and Carrie's probably on the call and listening, if Carrie can make a note that we'll just do some follow-up and have a more structured conversation with the right folks at the table although I have talked to both Teresa and Marissa on that particular issue, at the table so that we can follow up and make sure that there isn't any gray as y'all are working on your 2080 agreements. That's
okay. Okay, thanks.
Yep, and Kelly, this is Carrie. We have a meeting coming up on that topic.
Oh, perfect.
Internally. Yep, to get everyone on the same page, and then I can certainly make sure Jamie is aware.
Yes,
moving
excellent.
forward.
That sounds perfect.
You know, I guess I think it's kind of important. I know you've mentioned having internal meetings. Sometimes it's better to get our folks in those meetings early as opposed to later on. So we could have some input on how those decisions are made, but that's just a suggestion. Anyway, so Director, it looks like we've got about 2 minutes before you have to jump off and get on your next call. So I just wanted to give you a chance to make any final comments.
Well, I just want to say I really appreciate the forum and the continued dialogue. We have a tremendous amount of partnership with the locals and counties and local providers and a myriad of different groups. And so, like I said at the beginning of the conversation, our continued dialogue is incredibly important. It really does affect every part of our system, making sure that we have a true partnership at play and a dialogue where you can ask questions and I understand what issues are out there and that we're moving along together is paramount. So I really appreciate it. We will follow up on your last question. And if there's anything we didn't get to, please do send that over and we'll make sure that we address it. And then I would just say, in real time right now, y'all know best what's happening across Iowa. And so if you're seeing something that doesn't look right or that we're missing, particularly related to our COVID response, all you need to do is reach out to me, and we will take a look and we will respond. That's incredibly important to me. So thank you again for the time today. Okay,
thank you very much, and really appreciate your service during this time, Director. You've got your hands full. Keep at it, and hopefully you get some time off to spend with those kids.
Yes, that's the goal.
All right.
All right. Take good care.
Thank you very much, Director.
Bye-bye.
Bye. Okay, so let's see. Jamie Cashman, are you available here now to maybe make
yes,
a little report? Okay, great.
Great. So good morning, everyone. Just going to give you a brief update of what has been going on in terms of additional information on the response to COVID. Obviously, the biggest thing that we're following right now is with the governor's announcement on Monday, opening up 77 of our 99 counties for certain businesses, such as restaurants, and that will go starting today until May 15th. And they will be opened up under certain public health guidelines. And probably the biggest thing is just only allowing 50% of capacity. And we'll certainly be following the ramifications of that. We haven't received a lot of questions in regard to this right now, but as it goes into effect, I'm sure we'll have some additional follow-up. So we'll try to get back to you. We won't try, we will get back to you with the most timely information that we have. Kind of corresponding with that, on Wednesday, the Legislative Council met to extend the suspension of the legislature until at least May 15th. I think there's a lot of questions in terms of, what the true impact, especially on a fiscal level, that COVID will have on the state budget. And so I think that I would guess that when they do reconvene, it would be towards the end of May, or probably most likely into June. And so what we have been told is when they do reconvene, they will focus on priority policy bills and obviously funding the state budget. And so when they did come back, and it's been over a month now, they did appropriate funding to fund the state budget for fiscal year 21 through August. So they're at least good through that period of time. And so additionally, we continue to fight for funding relief directly to counties on a federal level. And we are expecting when the Congress reconvenes together, that they will be looking at a CARES 4.0 package. And we'll continue to fight that this aid goes directly to counties. And in that point, it's important that members continue to document expenses associated with combating COVID-19 for possible reimbursement by FEMA and other federal agencies. And we continue to encourage counties to try and determine potential losses in revenue as a result of COVID. And so you should have received a survey that went out to all counties asking for this additional information. This will be an important tool as we move forward and continuing to fight for federal funding. Kind of following along with that, we had some information that we have put out in regard to a NACO webinar that will be held today at 2 to discuss how counties can access and utilize FEMA's public assistance program for COVID-19 response and recovery. So we encourage folks to sign up for that for some additional information in regard to potential aid on the federal side. So with that, we'll certainly open it up to any questions, and don't hesitate, as always, to reach out to Lucas and myself as we move forward, and we can't thank you enough for your service.
So Jamie, can I ask you a question?
Of course you can.
So I was wondering, we've been hearing about the governor putting together a task force to consider how those federal resources will be allocated around the state. I'm particularly talking about the $1.2 billion that came in the CARES Act, which was, I think, phase 3 of funding. Can you talk about how our members can give input to that, and have we heard any additional word about when that process is going to start?
Yes, so we haven't heard any additional information in terms of when this task force would be convening. What we have heard is that I think what they're trying to come up, as what we heard from Director Garcia, is that the guidance that we've been receiving from the federal government has taken quite a while to get down to the state, and then ultimately out to us. And so I assume that when those guidelines for a variety of different programs are finally put together, that the governor will convene a task force. And so the biggest thing, we've been working on is encouraging, county participation as a part of that task force. And so we'll certainly, once we know when this task force will be convening, we'll certainly reach out to all of our members to address any of the questions that they should have.
Okay, thanks, Jamie. I appreciate that. And I guess I would just encourage you as members to make sure that you're reaching out to the governor's office and letting the governor's office know that you have a significant interest in that, and that you really believe counties and cities should play a role in determining the allocation of those federal resources. Again, those are monies that will, they're not necessarily free money. You do have to account for the expenditure of those funds, so you should make sure that that you do a good job of that if and when you receive some. But I think don't underestimate your ability to influence state and federal decision makers to make decisions that benefit, not you as county officials, but benefit the citizens within your communities, what those resources would be used for. So I guess we are planning on trying to schedule another call, I will tell you that, for next Friday to get some additional guidance from the governor's office and others about particularly the 77 counties that will be opened up and any other information that would be useful to you. And in closing, I just want to make sure that I want to thank all of you for the terrific job that you do for your communities every day to make it safer during this difficult and challenging time. Make sure you know that we're here to assist you in any way possible. And hope you have a great May Day and a nice weekend. Thank you very much. We'll close the call now.